MEMIC's 8-part series on dementia care is all about Alzheimer's disease and other types of dementia. It's designed to go beyond the basics with information that's not common knowledge, but every caregiver needs to know. Now, some folks have said to me, Heather, mornings are the worst. And one woman comes to mind. I remember her when she first came to our consultation service, and I tell you, I had a feeling I was gonna like her from the very beginning. Picture this. She's a wife who's been married for 60 years. She's hardworking, common sense, down to earth. Well, she walked into the consultation room and sat down and said, I'm taking care of my husband, but I'm fixing to kill him. She was talking about a routine that was hard every morning. She said, the mornings are gonna be the death of me. She said, I'm used to getting up. I get up early because I get breakfast started and I'm in the kitchen fixing breakfast. She said, I holler at him to come in there and eat, but he won't pay no attention to me. And I realized that she's been hollering at him for 60 years. And it's worked for 60 years. It's been part of their routine for her to get the meal started and call him into the table. Well, now, that part of the routine is broken. It doesn't work. When she calls him, he doesn't respond. So she said, I marched back there this morning, and it took me 5 or 6 times to get his tail out of the bed. We're arguing all the way from the bedroom to the bathroom. By the time I get him in there and cleaned up, then it's 10 o'clock before we get to the breakfast table. I said, you know, it reminds me of a lot of people who describe the morning as the hardest part of the day. They said the day gets easier the longer we go. So I started thinking that there's another fuel that works on these sick cells. A lot of people think fuel in the brain is oxygen. Yes, but there's another fuel that you can consider when it comes to how these sick cells work. It's blood sugar. Well, I went to a simple explanation of diabetes. You know how when a person with diabetes has a drop in their blood sugar, it changes their whole function. Their central nervous system is shutting down and you're getting the symptoms. Well, halfway through the diabetes spiel, she stops me and said, Heather, if you tell me to bring him breakfast in bed, I quit. I said, no, it's gonna be easier than that. Think about a person with diabetes. When their blood sugar drops, do you have to make a whole meal? No. In fact, the doctor will tell you to reach for a little bit of juice. I pitched it in as a chemistry experiment. I said, don't bring breakfast to bed. But what if we started in the morning with a little bit of juice? If you just brought the juice back and helped him to fuel up at the edge of the bed before you got into the whole morning routine, maybe it would help him if you could get that blood sugar up and going. Well, she went out with her homework, which was basically a chemistry experiment. Folks, she came back in a couple of weeks and said, Heather, you've turned this whole thing around. How come nobody tells us this stuff? Is it like the tricks of the trade? I said, hang on a minute. Tell me exactly what you're doing. She said, well, I'm already up because it's easy enough for me. I'm in the kitchen making breakfast and I just fixed the juice and took it back there to him. Now I've started counting in my mind all the things that she's changed. It's not just the juice. Now she's not marching back there in a bad mood. She's got her juice and she takes it back there and shows it to him. She's starting the steps of a positive physical approach, and I haven't even taught it to her yet. Well, she described how she would show him the juice, and he seemed to understand, what it was, so he started scooching up to the head of the bed, and he would reach out automatically just to take what she was giving him, and she said, I think it tastes good to him, so he likes it. I stopped her and said, one important question. What are you doing while he's having the juice? She said, well, we've got a chair back there. And I just have a seat in my chair. And while he's drinking the juice and I can tell that he's starting to wake up, we're just having a little visit. She said, we chit-chat for a minute. And then I asked him, are you ready to get up? And he says, yes. She's flabbergasted. But I helped her to count all the things that she's changed because, folks, it's not just the chemistry. She's changed the entire approach to the morning routine, starting with more visual cues, coming into his personal space, and getting down on his level. She's using one of the oldest tricks in the book, which is a little bit of social chit-chat before you ask somebody to do something. She just comes across a little less pushy. When she sits down and gives him the time to finish, it's again one of the most important steps that she's changed. People with dementia need a little more time. Putting all of this together, I helped this family and many others to realize it's not just what you do, but how you do it. To all the pros in the audience, we're going to come back to that as one of the most basic dementia care principles when we look at other parts of this brain and understand why they do what they do. Contact your MEMIC loss control consultant for more information or click the link below.